Let's dive into one of the toughest questions in modern medicine, maybe even in modern society. When things get tight, when resources are scarce, how do we decide who gets life-saving care? It's a huge topic full of really complex ethical questions and, very, very real human impact. We're going to break down how these impossible choices are actually made.
And to get right to the heart of it, let's just start with a scenario that, unfortunately, hospitals all over the world have had to face for real. 2 patients, both critically ill. Only 1 ventilator left. Who gets it? This isn't just a hypothetical puzzle. It's a real-world ethical nightmare.
So let's meet our patients. On one side, you have a 75-year-old with several underlying health issues who is in acute respiratory failure. Their need is immediate. It is incredibly urgent. On the other side, you have a 30-year-old. Right now, they're actually a bit less critical, but they have a much, much better chance for a long, healthy life if they get the treatment. So here it is, the big question. Do you prioritize the most immediate, urgent need, or do you prioritize the best long-term outcome?
Now, to make a call like that, you can't just go with a gut feeling. Ethicists and policymakers, they've developed a kind of toolkit, a set of established ethical principles to try and build a framework for making a fair decision. So let's open up that toolkit and see what's inside.
Okay, first up is a big one, utilitarianism. The core idea is actually pretty straightforward: do the greatest amount of good for the greatest number of people. In a hospital setting, that means using that 1 ventilator in a way that maximizes the total health benefits for the community. So maybe that means giving it to the person who's likely to live many more healthy years. It's a numbers game, really.
But then you have the principle of justice. And this one is all about fairness. It makes us stop and ask, are we distributing our limited resources and the benefits and risks that come with them in a way that's truly fair to everyone in society, no matter who they are or where they come from?
And you can't talk about justice without understanding this key difference: equality versus equity. See, equality is giving everyone the exact same thing. Let's say everyone gets the same size shoes. But equity is about giving people what they need to get to the same outcome. So everyone gets shoes that actually fit them. It's about tailoring the resources to create a truly level playing field.
So we have these foundational principles. But how do you go from these big ideas to, an actual working healthcare system? Let's look at how these principles get baked into the different models for deciding who gets what.
Well, you've got 2 pretty different ends of the spectrum. On one side, you have the needs-based model. Simple enough. This system prioritizes the people who are the sickest or the most disadvantaged. Then, on the complete opposite side, you have the market-based model. Here, healthcare is treated like any other product or service. It goes to whoever can afford to pay for it. Now, it's not just those 2 extremes. There are other models. For instance, some systems use priority setting, often with metrics like quality-adjusted life years, or QALYs. It's a fascinating idea where they try to calculate both the quantity of life a treatment might add and the quality of that life. And sometimes, when every other metric says 2 patients are on equal footing, some systems just turn to random allocation, basically a lottery to make the final choice as unbiased as possible.
But here's the thing. No system is perfect. Not even close. When you take these models out of the textbook and apply them to the messy, real world, they can sometimes create, or even make worse, what we call the fairness gap.
And that gap has a name: health disparities. All this means are measurable differences in health and in access to care that you can see between different groups of people. And those groups can be based on income, where you live, your race, you name it.
I mean, take a look at this. A really common example of a disparity is just geography. This chart gives you a visual of how healthcare funding, how access to specialists can be so much lower in rural areas compared to big cities. And that, of course, often leads to worse health for the people living there.
So, what's behind these gaps? Well, the research points to something called social determinants of health. This is a huge concept. It's basically all the conditions of the world you're born into, where you grow up, where you live, where you work. Things like your income level, for instance, can totally affect your ability to buy healthy food or live in a safe place. And all of that has a massive impact on your health, long before you ever need to see a doctor.
Okay, this all sounds pretty heavy, I know. But the whole point of studying these systems isn't just to point out everything that's broken. It's about figuring out how we can build something that's better, that's more just for everybody. So what can actually be done? The research suggests 3 really critical steps. First, transparency. Decisions about who gets what have to be made out in the open so we all understand the how and the why. Second, you need clear public ethical guidelines, no secret rules. And third, and this might be the most important one,
The communities themselves have to be involved in setting these priorities, so the final system actually reflects their values.
And in the end, it all just comes back to this one central challenge. It's a balancing act, right? You're trying to balance the needs of the individual person right in front of you with the overall health and benefit of the entire society.
Which really just leaves us with one final big question to think about. There are no easy answers here, but hopefully by understanding the principles and the trade-offs, we can all be part of a smarter, more compassionate conversation. In a world where we simply can't have it all, what do you think is most important?